Is on the other side to give us an update. How ready is the hospital in Entebbe? What is he seeing in his areas and what other people on ground saying? Come on up.
Well, a very good morning to you, Andrew Chamagero, and our audience. I'm coming to you from the streets of Abaita. I've been here in Katabi Town Council, Wakiso District, and this morning we'll speak vaccination because it is today when the Minister of Health will start the vaccination of the groups that it is stated earlier on, and according to the program, it will start with the health workers. If you can just remember from the minister herself, General Sacheng, she said that she will be the first, among the first people who are going to be receiving this AstraZeneca vaccine. But of course, the story now remains has the Ministry of Health done enough to sensitize the people into communities, and so that when this vaccine will be taken, there will not have to see drama like you've seen in the rubella vaccine for the children, when some families have had to hide away their children, or we'll see some people run away from the vaccination centers. But well, of course, from Entebbe, the point of view is that Entebbe Grade B was the first, especially when the index case was registered in the country. It was manned at Entebbe Regional Referral Hospital, and up to late, there are many people who have been treated from Entebbe Regional Referral Hospital and have gotten COVID with COVID-19. And the vaccination is as well going to be launched there at 2 in the p.m. And from the information I am having is that the minister herself will as well come and grace the function. And Entebbe Regional Referral Hospital has over 180 health workers that are going to be receiving this vaccination, and I'm told it will break down after it's launched at Entebbe Regional Referral Hospital. They will now move to other health centers in the country to be vaccinating the people here. But like I said, of course, the ministry doing its best to see that the vaccine does not have any resistance from the people in the communities. Has it done enough? And that question remains. Last time we inquired from the minister herself, Jen Ruth Acheng, and she says it's the media that is doing part. They have media information that is going around TV, radio stations, and in the papers to see that the people get enough information when these vaccines will be distributed across the country. But well, we wait to see, because that's their work. Only that she said even the press, including we, you and I, will have to be vaccinated. But only that she emphasized those of 50 years and above. So Andrew Chamagere, if you're not 50 years and above, please stay away. But now, as this all goes on, of course, people continue to receive hope each and every day. When last time we had the curfew, everything was, put under lockdown, and so we went on seeing those things being lifted. But we still have some other things that are still under lockdown. We do not have bars opening. We do not. Many other of those, the border riders have been still locked at the curfew time of 6 in the p.m. But as we get the vaccine, what is in the minds of the people? What do the people say? What should have been done as far as how we are slowly progressing with manning down COVID-19? Let me just seek an opinion from the people on the streets to tell us what should have been done. Let me start with the gentleman. Welcome with me on Morning at Entebbe.
Thank you very much.
What do you think should have been done? We have the vaccine now. The country has done its best to man down COVID-19. What do you think should be done? We have the lockdown still.
Our name is Kayanja Lewis, Councillor LOC5. But personally, we have the government has to sensitize people, has to teach people how it's going to do everything. Is the drug reliable? That it is 100% reliable? Are the schools going to be opened if the drug is brought to the people? People need to know, are they going to continue normally the way they have been doing it before COVID-19? Yes. We hear it is an experimental drug. And how are the people going to be sure that they won't be affected?
We still have the borders locked at 6 in the p.m. We don't have bars operating, but we are having hope the vaccine is now here.
We don't have hope. That's why we are saying the government should come out and sensitize people. Even religious leaders are not ready to be vaccinated. We have to come in the line that everyone knows the advantage. How am I going to benefit with the drug? The government is saying the normal way of living will not be there. So how are we going to start to be vaccinated? Yet things are they're not going to change.
Are people receiving the vaccination information in your community?
No, not even at one time like this. They just hear from rumors that the vaccine is here. now they are going to vaccinate them, and the people are not ready. So we have to come together on the table and we ask people, are they ready? And if it's that, where are they going to benefit from that? Because people are not ready to be vaccinated at all.
Thank you very much. Nkyayogerako n'abantu ku street za kubayita ababiri wano, especially bagana bafa bavuga boda nti bo omulimo gwabwe saawa 12 saawa emu olumu olaba poliisi eyitaayitamu n'ebayolaawo. Naye tubuuza nti eddagala erigema korona bwe lyalabise essuubi ki? Kanjogereko n'omukulu jassa tubuulireko kiki olowooza ekyandibadde kikolebwa mukulu?
Ze Museveni yalutongeddeyo ku saawa ku bantu aba boda kubanga eddagala lya coronavirus lyalabise at least saawa 3 z'abantu zibaddirako waka ngubu yatugamba kafe tandike saawa 3 kubanga abantu babonaabona okudda waka bantu basula wala entambula be bateriiwo bantu babakwata ekiro obubaddiya lwakuyita mukuusukuusu bwa butaba na ntambula endowooza yange mukama wange.
Kale weebale nnyo ssebo ku street wano mukulu tubuulireko olowooza kiki ekyandibadde kikolebwa nti kati eddagala lyalabise naye mwe aba boda tulaba mukyakola saawa 12 babagala mubeere nga mwanyuse n'ebintu ebirala endowooza yo?
So mukama wange neyanzeege okuleeta ekibuuzo ekyo naye obuzibu fe ababodaboda bwe tusanze naddala mu ggombola yaffe neye Katabi twafunye okutegeezebwa nti bodaboda zirinako masaawa 12 ate kitaabadde kituufu. Tuyina famire, tuyina abaana, kati abaana bagenda kuddayo mu masomero tetunnaba kwetegeka. Kati awo kitegeeza omuwa bodaboda omugaa nti akome saawa 12 ate ng'alina okunoonyeza abantu be ekyokulya. Mazima gavumenti yalibadde tusaasira ne tulongoosezaamu ekyo netusobola okuyiza abantu baffe ekyokulya netusobola okubaawo naddala kati ngaffe abasajja kati nganze golaba wano amanyi aganze muwawu Joseph nze nkulira ebyokwerinda mu bodaboda ye Katabi yonna naye tubaye tusaba gavumenti etukusaasire atist etuse ku saawa 3 tusobole okubeera nga tuyiza abantu baffe ekyokulya tusobole okubeera nga tweddaabulula kyembadde nsaba mu ekyo.
Kale weebale nnyo ssebo. Well, Omuntu Wawansi, those are the voices you can hear from the people here on the street, especially when we now have the vaccine and the corona. The pandemic is, of course, every day, being manned, and we've not had our cases, go shoot so high like in other countries across the world. But well, we wait to see and follow up on what the ministry's program is like on the vaccination. I will personally be at Entebbe Regional Referral Hospital when these health workers will be receiving the vaccine. I come back to you in the studio, Omuntu Wawansi, nkomeo joli programu yeyongere mu maaso. Good morning to you and our audience.
Ivan Walunyolo.